name is Dustin Fry. I am a speech-language pathologist, and I went to Bowling Green State University. The first 4 years were undergrad, and I had an extra 2 years for my master's degree to get my speech-language pathology certificate, I guess. I went to Lincoln View, and at first, when I graduated, I didn't really want to go to college at all. I actually wanted to farm with my dad, but there's not enough acres there to continue to farm. So I kind of looked at something and needed to go to college, and at first I thought I was going to go on to be a school teacher because that's really all I knew. So I went off to Bowling Green to become a teacher and got into the beginning of my sophomore year and realized I didn't like it. So I started to look around and kind of found speech-language pathology, and BG also specializes in that program. So I got to looking at it, and that's what I decided to go for. Right. So I've been with Bancrest for 4 years now, going on my 5th year, and kind of started off in the hospital. I chose to stick with the adult population instead of kids, but started off at the hospital in Van Wert, and now I'm here at Delphus Bancrest Nursing Home. And I guess a typical day for me, a lot of patients that I see I work with patients on their swallowing, on their speech, on their voice, on language. A lot of times if they come in and let's say they've had a stroke, a lot of times they'll have a really hard time expressing themselves verbally. So we have to address that aspect. And then also it affects their swallowing, so they can end up with pneumonia. So a lot of times, we're doing exercises to improve the swallow, or we're doing exercises, I guess for the speech and just to get their language back. But with the swallowing, we recommend a diet texture and a liquid texture as well. So we might say that a patient needs to have thin liquids, nectar thick liquids, or honey thick liquids, depending on the severity of their swallow deficit, or they need to have regular textures or just altered textures in general. It might be puree as well. So a lot of different things that we can do as speech therapists. When you go to school, I guess you'll find out too, you can work with pediatrics or you can work with the adult population. It all just kind of depends, and as you go through school, especially once you get into grad school, you'll kind of find your niche on your population of where you want to work and with what population you want to work with. Between being a school speech therapist and being a speech therapist in a medical setting, my wife is actually a school speech therapist, and she works with preschoolers. So they deal a lot with IEPs, and speech-language pathologists are usually the ones that actually kind of, I guess, they do a lot more than like your physical therapy and occupational therapy with the IEP. A lot of times they're case managers of an IEP. So there is a lot of paperwork in that aspect, but there's also a lot of paperwork in the medical setting. You have to document everything you do very well, and they prepare you in school for that. Towards the end of your grad school, you have what's called a full-time internship. So by that point in time, you should know what population you want to work with and where you want to work. So they'll give you that option. So let's say you go to a hospital, and then you kind of get like, okay, this is the real deal, and you learn, I guess, the everyday life of a speech-language pathologist in that full-time internship. You learn how to document, you learn how to, work with others, like PTs, OTs, nursing staff, doctors. And then if you choose to go into the school, you get to learn how to work with teachers and other school administration and I guess how they do things. But with school, you can do early intervention, so that's anything before preschool. You can also work with the preschool population, and then you go kindergarten on up. And a lot of times in the school, you're working more with like a kid's speech or sometimes voice, but mostly speech and language, not so much swallowing. Physical therapy is about 7 years now, and you get what's called a clinical doctorate. There has been discussion of getting a clinical doctorate for speech-language pathologists as well as occupational therapy, I believe. I haven't heard of any schools doing this yet, but I also can't say for certain when it's going to happen.
Hi, my name is Linnell Dews. I am a speech-language pathologist. and I work primarily in the schools. I am employed by the Allen County Educational Services Center. So I am itinerant, which means that I travel, and I currently travel to 6 different schools in 4 different school districts. And my work week is pretty flexible because I can travel, but it is challenging because I have to keep lots of different dates and caseloads for that many different schools straight. But in general, I love my job, and I love the people that I work with. I love working with students, and I love the school setting, which is why I chose the school setting over the medical setting. Plus, it's nice because you get all of the school holidays and summer breaks. You get those perks just like teachers and students. And it's nice because you have a little break from work and you still get paid over the summer, just like teachers. So I did my undergraduate coursework at the University of Cincinnati, and then I went to graduate school to complete my master's at the Indiana State University, and came back to Ohio because this is where I'm from. But the beauty of speech-language pathology as a career is that you can work anywhere in the country. It is in very high demand right now, in both the medical setting and in the school setting. And you can even work for audiologists, which are hearing doctors, and you can work for private practice, companies that have private practice, or you can work for contract companies that work with multiple healthcare facilities. And I do have some experience with that as well. In general, it is a challenging career. You learn every day, you learn something new. So you have to be a lifelong learner to pursue this career. And that doesn't matter what setting you work in. If you work in the medical setting or the school setting, you will be a lifelong learner. So you have to be open to that. You have to enjoy what you do. If you work in the medical setting, such as in a nursing home, you will be working with the geriatric population, which has a different approach than working in the schools. In the schools, you work with students anywhere from preschool through grade 12. And you work on a variety of things like language, articulation, phonological disorders, and you even work with kids with autism, kids that do not communicate verbally but use devices. So you can get some really cool training on how to use some augmentative and assistive communication devices, such as iPads with communication boards on them, and various other programs. And you get to collaborate with some other really cool professionals as well. On the note of being a lifelong learner, you also have to take continuing education courses to satisfy your state and national speech, language, and hearing association requirements. I think it varies based on your state board requirements versus your national board requirements. Our national board is the American Speech, Language, and Hearing Association. The state board is the Ohio Speech, Language, and Audiology Association. Kind of some long acronyms there, but the OBSLPA and the ASHA websites are some great resources. So if you would like to learn some more about speech language pathology as a career, you are more than welcome to visit those websites, because those websites both have a ton of useful information and Q&As, frequently asked questions as well. So if you would like to learn more rather than asking a speech pathologist and you just want to do some of your own research, check out some of those websites. So a typical day for me primarily consists of treatment. That is the bulk of what I do. And treatment involves planning. You have to plan for each of your students. So you're kind of doing planning like what a teacher would do, but teachers plan overall lessons. Most of the time my treatment sessions last anywhere from 20 to 30 minutes. I do some group therapy, and I also do some social group therapy. The social group therapy that I do is primarily with my multiple disabilities units. Those are self-contained classrooms where the students are much lower functioning than students in your everyday classrooms. Some of my students in the multiple disabilities units may go out for some of their classes, but for the most part they're in the multiple disabilities unit, and they have some more severe communication challenges. Okay? So another aspect of my day is paperwork. If you do not enjoy paperwork, this probably is not the career for you. It seems like that's probably the second biggest part of my day. Paperwork is very important. You have to be very organized to pursue this career. You have to do billing for your services. You have to do IEPs and ETRs. IEPs are individualized education plans, and ETRs are evaluation team reports. You do ETR reports for each student every 3 years, and you do IEPs every year. So that is a lot of paperwork. And this does not include other paperwork that you might have to do, miscellaneous paperwork such as progress notes, which are usually done every quarter or every semester, whatever your schools happen to be on, emails, other documentation, just miscellaneous stuff that you kind of have to do. You have to communicate and collaborate a lot with your coworkers, which include teachers and other faculty such as school psychologists. And a lot of times in coordinating IEPs and ETRs, you work closely with the school psychologist. So that is important, having good communication and working relationships with your coworkers is very, very important skill to have in this career. And also another big part of my day is attending meetings. So you do the IEP and the ETR paperwork, but then you have to go to the meetings. So I try to go to as many meetings as I possibly can, but it's not always conducive to due to my heavy travel schedule, and I'm not always in the same building on the same day every week. Sometimes I go out of my way to go to a building that on a day that I normally wouldn't go to attend a very important meeting. Normally, if it is requested that I attend this meeting, I will be there. I will make every effort to attend a meeting, but because I am an itinerant speech therapist and I'm contracted via the Educational Services Center for the schools that I service, I do a lot of traveling. So, and keep in mind that the time that you spend traveling is not time that you can be productive. So I do take a lot of my work home with me, but that's just the nature of working in the schools and being a contract employee. If you work in the medical setting, you typically don't have to take home as much work, but I really do enjoy my school-age kids. Some states do have what is known as a SLPA, which stands for Speech Language Pathologist Assistant. It's very similar to an OTA, or Occupational Therapist Assistant, or a PTA, a Physical Therapist Assistant. Basically, an SLPA is a bachelor's degree level profession. You get to do the treatment in most states, but not the documentation. To do the documentation and sign off on that fun stuff, you have to have a master's degree, which I have, but unfortunately in the state of Ohio, entry level for speech language pathology is a master's degree. You have to complete at least 6 years, that's 4 years of undergrad and 2 years minimum of graduate school, to obtain a master's degree. Ohio does not allow speech language pathologist assistants. So the state of Indiana does, but Ohio does not. So if you are interested in SLPA as a career, that is an option, just not in the state of Ohio. You can also pursue a PhD in speech language pathology, but typically a doctorate in speech language pathology is more for those who choose to do research. So if you're interested in the research aspect of things, probably a PhD would be more suitable for you. What I love about my job is working with so many other people. I get to meet a lot of new people and a lot of new students. I really enjoy working with my students and being a good role model for them and giving them a chance to get out of class and do something fun, even though we're still working on their communication. I really enjoy giving them feedback and watching their progress. That's the big thing. That's the most rewarding aspect of my job, is watching students progress. I like working with school-age students because as opposed to the geriatric population, you don't really see a whole lot of progress with the geriatric population because they're aging. You teach them more compensatory strategies just to get by. School-age kiddos, you are actually teaching them how to be better communicators, whether you're working on their articulation skills, making their speech sounds, their phonological skills, their social and pragmatic language skills, which is how we interact in social settings with other people and how we have conversations and practicing good conversational manners and skills. There is a plethora of things that pertain to communication, and I really, really like the challenge, especially of making lessons that will stick with my students. And when I see their progress and I see their skills carry over, the skills that I have taught them carry over into real life situations or in the classroom, it helps them become better learners, and it helps them to grow, and that is just truly rewarding for me.